In this month's Did You Know, we're going to take you through the most common call the fire department runs, the medical emergency, and hopefully offer several tips that you can be doing prior to the arrival of the ambulance or other first responders that's going to better streamline the call. Let's look at a medical emergency from our perspective.
Barbara, are you okay?
I'm not. Call an ambulance, please.
Okay.
I can't get my breath.
What's the address of your emergency? Okay, you said 13361 Lincoln Road. Okay, what's the phone number you're calling me from? Okay, tell me exactly what happened. Okay, how old is she? Is she awake? Okay, and you said she's having difficulty breathing? Okay, hold on just a second for me. I'm going to get help sent your way, and then I will have some other questions for you. So just a second. Attention Highland EMS, Highland-Pierron Fire Department, Medical Emergency 13361 Lincoln Road for a 51-year-old female conscious with difficulty breathing. Highland EMS, Highland-Pierron Fire Department respond. Timeout 1824. Alright, is she completely alert? Is she changing color? Okay, is she clammy or having cold sweats? Does she have asthma or other lung problems? Does she have a prescribed inhaler? Okay, has she used it yet? Alright, I'm sending the paramedics to help you now. Stay on the line and I'll tell you exactly what to do next.
Here are a few things that you can do prior to our arrival. Number 1, turn on some lights. Not only where the patient's located at, but any way into accessing the patient. Next, unlock doors. Although we may come in through one door, the stretcher may need to come in through another. Opening the garage door may be advantageous as a route for us to come into the house. If time allows, gather up the patient's medications and place them in a bag so we can transport those along with the patient to the hospital for the doctors and nurses to look at. If the patient has any paperwork that has anything medical diagnosis, medical history, allergies, things of those nature, would also prove very beneficial for our EMS crews. Also, if you can gather the patient's ID card and insurance card, the hospital staff and EMS will also need that information. If you have any pets that may hinder first responders from doing their job, now would be a good time to place them into a back bedroom or behind a gate. If there are any vehicles in the way where the ambulance needs to park at or the stretcher needs to come in through the house, now would be a good time to move the vehicles out of the way for your first responders. And although it's not necessary, it'd be nice if a family member can wave down the first responders as they arrive on scene so they ensure that they are at the correct address. Also, now is a good time to remind you to make sure your address is clearly visible near the front door or at your mailbox.
Highland 4006 is on scene.
Oftentimes, firefighters may arrive ahead of the ambulance. Their job mostly is to support the EMS crew throughout the call. However, if they arrive first, they're going to perform the assessment and start at least some basic medical care.
No, I don't. Call my neighbor. It's like a half an hour, I think.
Finger here. Upon the arrival of the EMS crew, they'll receive a report from the firefighters and continue the assessment from there. This is Barbara. Barbara, 51 years old, COPD patient. Today having difficulty breathing, got progressively worse this morning whenever she got out. She has been compliant with her medication. She does have clear lung sounds. She's currently set at 96%. We did put her on the monitor breather at 15 liters per minute. She does seem to be doing better, but I almost wonder about what an albuterol draft would do for her. While you do this, we'll go out and get your stretcher for you. We do have our emergency paperwork here gathered up for you. We do have her ID card and her insurance card and her medications here. I'll go ahead and take these out to the ambulance for you. And we'll get your stretcher for you. EMS crews are highly skilled at working in the emergency setting. They're trained to gather information quickly and make decisions regarding treatment and interventions for all different types of emergencies. Many interventions occur in the field before the patient even reaches the emergency room. In some events, EMS crews work quickly to stabilize a patient before transport can be initiated. Here's a look at what some of that pre-hospital treatment looks like. Thanks for watching this month's educational piece. Please like and share this video so that others can be better prepared too.